Coronaviruses are actually a very large family of RNA viruses. They are actually virus, even though there's a novel coronavirus or a new coronavirus that's circulating, they're actually very familiar to humans. So probably about 10 to 30% of colds that people experience over the winter months and cold and flu seasons are caused by coronaviruses. So they have an RNA genome, a positive RNA genome, and they are named coronaviruses because they have these spike proteins that stick out from the surface of the virion. And when people were first looking at these under a microscope, it looked like a crown. Okay, so it looked like a crown of spike proteins, and corona is Latin for crown. So there are lots and lots of coronaviruses. They infect a wide range of species. So obviously they infect humans. They can infect mammals like bats, birds, things like civet cats, even camels. So coronaviruses are all around us all the time. So with this new coronavirus, the first thing I want to say is our knowledge of this new virus, how it's spread, unique features, pathogenesis, all that, it's really rapidly evolving. So I don't think we have a full picture right now on exactly how it's different than, let's say, SARS, which is kind of like cousin to this particular coronavirus. Um, you know, there are some unique features. There's been some literature published so far. So papers are actually coming out pretty quickly. People have isolated strains from patients that have shown up in hospital. They're trying to do phylogenetic analysis to see how similar they are to other coronaviruses that we know about. I'll talk about a few things that we know for sure about this coronavirus. So at this sequence level, at the nucleotide level, it's about 87% similar to the SARS virus, right? So we've actually seen in the 21st century 3 outbreaks of coronaviruses. This will be the third. SARS was in 2003, and then we had MERS, okay, in 2013. So this virus looks similar to SARS in some ways, but we know that its surface glycoprotein that it uses for entry is different. What that actually means in terms of the viral life cycle and pathogenesis, we're not so sure yet. There's some good things about the differences in this virus as compared to other coronaviruses, and there's some bad things. The good things are that it appears to be less fatal than SARS so far from the information we gathered. So when we talk about the mortality rate for SARS was about 10%. When we talk about, so that's good, right? Good that it doesn't seem to be as severe, or so we think, at the moment. The other thing to point out about the fatality rate is 80% of the fatalities are in individuals over the age of 60. So people that have usually other comorbidities, other health problems, cardiovascular problems, maybe lung problems, maybe they're smokers. So in young, healthy people, it seems to be not a fatal illness. One of the things that maybe is less good about the virus is, even though the infection isn't as severe, a lot more people are infected. So when we talk about the morbidity is significantly higher than SARS. SARS infected around 8,000 people. Best estimates of confirmed cases right now are 25,000, and some people think that's an underestimate, and it could be more like 75,000, which would drive the fatality rate down. But there seems to be more community-based acquisition of this virus than what we saw with SARS. SARS was a virus that a lot of people acquired in a hospital setting. It was a nosocomial infection. Healthcare workers and other people in hospitals that came in contact with infected patients primarily had that infection. So some good things and bad things, but it is different, hence the name, the novel coronavirus, but we're still learning more about it every day. The diagnostic test right now is just an RT-PCR, so just a reverse transcription polymerase chain reaction. So essentially, there are unique features in the virus that we can design primers to. We can take samples from patients, whether that be blood samples or samples from sputum or nasal washes and things like that. And we can run the RT-PCR to see if they are positive specifically for this new coronavirus, right? So lots of people will be generally, they won't be positive by RT-PCR, but serologically they would be positive for coronaviruses because they regularly infect humans, they regularly cause colds. But so there's a good diagnostic test, so when we have confirmed cases, we can say with good certainty that yes, this individual actually has this, COVID-19. So one of the good things about this virus is one of the bad things is for control measures. So most people with SARS, when they were actually infected, got serious illness. And so they either stayed home or they presented to hospital and they could be identified as having SARS. The evidence for this virus seems to suggest that some people don't get that sick, and some people might even be infected and be asymptomatic, which means that they feel fine, they go to work, they go to school, they go to the supermarket, and can potentially spread. So with SARS, isolation and quarantine were very effective because most people had serious illness. And so we could use those measures. We could use contact tracing, right? So if people came to the hospital, we could get in touch with people they've been in contact with and then, help monitor the situation. It's going to be a lot harder for this virus for that reason, because it doesn't cause serious disease. So good that it doesn't cause serious disease, but it makes it more challenging to control. I don't know, I'm not very confident we'll get a vaccine out super quick. It might be the case, it's winter in China, it might be the case as we move into spring, people aren't stuck inside as much, we change some of our kind of population social behaviors, that might help it fizzle out. Antivirals may help. We don't have any licensed antivirals for coronaviruses, but there are some in the literature that we know at least work in vitro, work in animal models, and so those might be, we might be able to use them under some kind of compassionate use policies. So probably the isolation and the quarantine is going to be more difficult. I'm not going to say it's not going to help, but there are some unique challenges to this particular virus for that reason. Depends why you're wearing the mask. There's certainly good evidence that if you're sick, wearing a mask will reduce the infectious particles that you transmit, right? So maybe if I just talk for a minute. Okay, so these respiratory viruses, so coronaviruses are respiratory viruses. They transmit through respiratory or aerosol droplets. So when you're talking, when you cough, when you sneeze, you release small bits of aerosol particles into the air, and if you're sick, these can have infectious viruses with them. So obviously if you're sick and you wear a mask and you can reduce the number of infectious particles that you're putting into the air, that can help stem transmission. I don't know that there's a lot of evidence that if you're not sick and you wear a mask, that you significantly change your chances of contracting the illness, for a few reasons. Because respiratory droplets aren't the only way things transmit, right? I can sneeze onto this table, there'll be virus on this table. If you touch the table and then rub your nose or touch your eye, you can also contract the virus in that way. A really interesting side bit here, we think probably that's how respiratory transmission is how this new coronavirus is actually spreading. There's a little bit of evidence that people might shed virus in their stool. So there could be some oral fecal transmission happening. There have been a few people that have been positive by PCR for virus in their stool. It's not live virus, right? We'd have to do other tests to see if they're actually shedding live virus. But that's just to say we're not exactly sure how transmission is happening at this point. So if you're sick, wear a mask. That can help save other people around you. Your best way to stay healthy if you aren't sick is to practice good hand hygiene.